Hello, everyone. Welcome to another episode of Health Talk. Here with me, I am with Dr. George, the CEO and owner of Jogiled Hospital, aka Jogiled Home Care Agency. Okay, we're going to be asking Dr. George a few questions about health tips, anything health related. We're going to ask him, and he's going to give us good and clear answers to our questions. So let's move on. Dr. George, good afternoon.
Good afternoon. How are you, beautiful lady?
I'm fine, thank you. How do you feel today?
Good. Just a little stressed based on our activity, how it runs.
Thank you for joining us today.
Thank you.
Yeah. So, Dr. George, we have a few questions for you, if you don't mind. I would like you to give us clear answers to the questions because you're the doctor and we want to know.
Okay.
Okay. So here goes. I'm going to ask you the questions one after the other.
Okay.
Then, we move on. So the first question is, Doctor, for people meeting you, right, for the first time, can you tell us a little bit about your background? How can you define yourself as Dr. George?
All right. I think that question is quite deep because talking about meeting me is talking about my whole journey as a doctor and my interest to be in the health line. I think my interest to be in the health line started way back when I was still in primary school. I had a terrible accident. I spent weeks in the hospital. In fact, people thought I was already dead,
Right.
Until eventually I came back. And I saw doctors. Some few doctors I so much loved them. I told myself I want to be a doctor. That was where the interest to go into this profession started. Gradually until much later in the university days and through divine guidance and help, I found myself in the medical, field. The journey has not been easy. I wouldn't say it has been easy. It has been ups and downs. But one thing, those journey looking back has given me more assurance that this is where God wants me to be. And there is something He wants me to do. So I practice this profession, not just as a profession, but as a calling. I feel like I'm here and this is where God wants me to be. Any other thing I do could just be a distraction, but this is where God wants me to be.
That's lovely. So what can you say is the vision behind Jogiled Hospital, the one you currently run?
Okay, Jogiled Hospital was also born close to the time I was about graduating. I thought about, we had, I think in one of the lectures, they're giving us concept about mortality and major causes of mortality. And we noticed we thought that there are delays. The causes is about 4 days or 3 days or something like that. They were talking about delay in accessing healthcare, delay in decision making, delay with the normal bureaucracy when you get to the hospital and all that. The time for the doctor, before the doctor comes out, before the accident and emergency, before they make up their mind to bring you in. I felt, can't we do something better? And looking at the things in the teaching, then University of Nigeria Teaching Hospital Enugu, Itukozara, that was where I would do our posting. And sometimes the things I saw there, I felt, can't we do better? And I felt, yeah, I could do something, and that was where the concept of Jogiled, hospital and home care agency started. A hospital that will attend to people quickly, removing one of the causes of mortality, which is the delay in the bureaucracy and all those kind of no protocol. When people fast, there are people who come into Jogiled. Our instruction here, even before they open up card, we've started even attending to them. Much more of even paying for deposit. It's when we are sure that the person is stable, can even start talking about where is your card and start doing all that. So, because I've seen people who in the process of trying to do all those, get card, pay for deposit, the person is gone. So I felt I could do something. Let me do something about that. So then the other challenge is sometimes the delay people have in accessing healthcare depending on their location, and that gave birth to Joe Gillett Home Medical Care Services, where with a phone call, our staff, our ambulance service will come to your location. Both the doctor and other healthcare will attend to you there at the comfort of your environment. Without you stepping out of the house, the samples will be collected, bedside investigations will be done immediately, and you get results and treatment start almost immediately. So on that note, Joe Gillett Home Care Medical Services was also given birth to. And that too was also directed to aging people, because then back then, when I noticed one of the greatest mortality I saw then is with aged people. And I told myself, I want to get old and be taken care of. And the way we handle our old people it's not so nice. Even some people who made money as young people, when they get old, they are not taken care of.
Most times their children leave them. And,
some of the children are abroad and all that.
Yeah.
Like even one of my clients then, most of the children are outside Nigeria. The external people that is taking care of them, some old women and all that I was living with them, with this aged couple, will leave them. They will pee on themselves. They treat them like dogs. These are people that they were great when they were as a young man and women. So I felt Joe Gillett we can attend to when people are aged. Our staff can be, if you want in-living caregiving, we can send our staff to live with you. If you want our staff to come and go and be checking on your parents, each parent, we can be doing that and be giving the children, updates on. We'll care about their feeding, we'll care about everything about their health, even to the detail of the kind of room where they stay, their hygiene and all that. So that is how that one also came. And one more, sorry, I know my time has elapsed. One more thing about this, because I'm so passionate about this home care, And,
okay, go on, sir.
All right. So it's part of the reason which, as I said, the Joe Gillett Hospital and Home Care Agency, part of the thing which we do to also cut down delay decision making is what gave birth to our Joe Gillett School Health programs. Our Joe Gillett School Health program is designed for most especially private schools or schools, secondary schools and primary school, where each child, a little token they pay covers their health need for the whole term. And we set up mini health clinic within the schools where our staffs will be there 24/7 to take care of them. If there are people in the boarding school, if it is a day school, then you can be taken care. And at any emergency, if it is something beyond the health care, the person can be moved to our facility, or our ambulance can go and pick up the child to our facility.
So, sir, what you mean is you guys offer home care service and you also offer services to schools?
Yes.
Okay. So are these services, are they like meshed or they are separate services?
No, they are separate services.
Okay, that's lovely.
Thank you.
Okay, sir. We hear a lot about self-medications. We hear people, take self-medications, especially malaria and antibiotics. What do you really have to say about that?
Well, it's one thing I always speak against, self-medication. Drugs, as it can serve as a tool for blessing, it can also be a poison in the hand of the untrained.
That's deep.
The reason why you have health professionals is for them to attend to your health need. It's quite unfortunate. Sometimes people prioritize finance above their health. But it's quite unfortunate. Self-medication, I condemn it today, I will condemn it tomorrow. The person is not doing anybody, but the person is doing himself. It's like shooting yourself. Self-medication is not only when you take medication unprescribed or when you make self-prescription for yourself. And no, it also goes when you meet the wrong persons and they make prescriptions for you. They include your chemists, the lab person. After they must have done the investigation, they make prescriptions for you. They include even your parents, because we have our parents who are doctors. They're acting like doctors, make prescriptions for everybody. You know what I'm saying?
That's a general theory in Nigeria. So,
or even that your nurse,
a general theory.
that your neighbor, that is a nurse. You say a nurse. Nurses are not trained to treat. They are trained to care for somebody who is sick, following the prescription of a doctor. the only person that is trained to make prescription for you is a doctor. Just in Nigeria, anything goes here. And I've seen the deadly consequences of this in almost every day I go to the clinic. I had a patient I lost. That was early this year. A young lady around, that should be around 28, looking for the fruit of the womb. With the young man who is still struggling and trying to make ends meet. When the lady came to me, the face was swollen, the legs were swollen. I was interested to know what brought them to. The story goes that they were looking for the fruit of the womb and they went to this lab person, and the lab person, after the whole lab, started giving the woman injection. That is infection that is making her not to conceive, and was injecting her back to back. At the end of the day, she started noticing that her face was swollen, the legs were swollen. That was when the lab person got tired of the injection and said they should go to hospital. And unfortunately, when they came and I saw them, I requested for a kidney function because I was concerned about that. The creatinine and urea level is terrible.
Wow.
Very, very high. Now, these are couples, the woman looking for the fruit of the womb, now eventually having kidney failure. As a result of one stupid lab person.
I hope the lab person was sued for that, because...
So most times, she doesn't know what, if assuming maybe I didn't say anything, and for her, so the time she's knowing the truth, she's already she's battling with her life. She doesn't have time to be suing. So the thing there is that, and the funny thing, that same person will still do it to another person.
That's the thing. Maybe
the lesson.
Yeah.
Sorry for cutting short. The lesson in this is that it's not up to the lab person. For them, they see that, and the chemist and the nurse and all that, they are doing business. They want to make money. The wisdom is you need to care for yourself. You don't just submit yours. The human body is the most precious thing. So I want to give this analogy before we jump into another question.
Yeah.
Because I'm so passionate about this. Some of us drive very nice car.
Yeah.
That sweet ride, maybe you bought recently, Lexus, Lamborghini, and all those kind of nice car you bought for yourself recently. You can't park that car any mechanic to just go and lose something in the engine.
Yeah, you be very conscious about it.
Because you value that car. Something replaceable as a luxury car that you value that much that you don't give it to any mechanic to just jump in and lose something. Your life is is a million times more valuable than that luxury car. And it's not replaceable. Yeah, we're doing organ transplant, but you can see how it fails. Now, you need to care and value yourself. If you don't value yourself, nobody will value. Is it the chemist man that will value? The chemist man will just see this one did not work, this one will work, and do and collect his money. Yeah. Please, submit yourself only to trained professionals and get your treatment. And stop self-medication, stop submitting yourself to wax.
Well said. Well said. What do you feel like people should know about their health? Like, what people should know, a general ideology people should know about their health.
The thing is that I think generally all of us should be conscious about our health. One of the greatest blessings we can have is good health. Let's be health conscious. In every decision we take, where we live, what you eat, your social life, what you drink, before you take a decision, you should be able to ask yourself, what will be the effect of this decision to my health? Because after God, the most important thing in life is your health. Even if you have billions, your billions can't save you if you're on the sick bed. You can't enjoy your billions.
Yeah.
Ask the billionaires that died on the sick bed. Michael Jackson with all he had. So please, take care of this, your precious body. And take care of yourself.
Thank you, sir. Thank you, doctor. We've heard you. So finally, how can people reach out or book an appointment with Jogilet Hospital?
You can always reach across to us. Our office is at number 133 Abowere Road, Aba, opposite Ochendo. You can always get across to us online through our various number like 080-864-35031. Our website is also there on our platform. You can also read about us on our website. You can also chat me up. These various numbers have WhatsApp this thing attached to it. You can also chat me up. We also do online consultation services. So through our website, we can do online consultation service. We can book one-on-one appointments. Just put a call across. We'll be there for you.
Okay, thank you, Doctor, for sharing your knowledge with us today.
Thank
We
you.
really appreciate, and it was really helpful. And I
Thank
know
you.
all the viewers out there, they learned something from everything you said today. To everyone watching, your health is your wealth, so take care of your health. And you can reach out to Dr. George on Instagram, TikTok, Facebook at Dr. George, and the hospital official account at Jogilet Hospital. Thank you for watching. See you guys next time.